Hey everybody, today we're going to do a quick tutorial on the pre-hospital use of Push Doss Epi. We're going to briefly talk about the pharmacology of Push Doss Epi MAP and then how to administer it. Push Doss Epi will be used for our patients experiencing cardiogenic, anaphylactic, and septic shock. Something all of these shock classifications have in common is systemic vasodilation causing profound hypotension and really underperfused vital organs. We can see this decline in patient condition measured in a few different things, but today we'll focus on MAP, or mean arterial pressure. MAP, or mean arterial pressure, is the average arterial pressure maintained throughout one cardiac cycle. The lower the MAP, the less adequately the organs are going to be perfused. So when a patient's MAP falls below 65 for an extended period of time, this is when we see the other organs start to shunt their own blood up to the heart and brain in efforts to keep those perfused the best. 65 is going to be the number for everyone to remember. That's going to be our goal when administering Push Doss Epi. So how do we calculate or find MAP? The most common formula used is your diastolic blood pressure times 2 plus your systolic blood pressure and then divided by 3. Is there an easier way? Yes. MAP can also be easily found on your monitor, so it's located just to the right of your blood pressure reading here on this Zoll monitor. Here on this LifePak monitor, the MAP is going to be located right to the left of the blood pressure, right at the bottom of the screen there. So let's say we're out for a 64-year-old severely septic and hypotensive male patient. Patient's initial blood pressure is 80/50, giving us a MAP of 60. After a fluid bolus, you decide to call the hospital for orders on Push Doss Epi. They agree that the patient's a great candidate for Push Doss Epi. So what is our dose and how do we make it? Our adult dose for Push Doss Epi is going to be 50 micrograms or 5 milliliters in IV push. This is going to be constituted as 10 micrograms per 1 ml. So when you do mix your Push Doss Epi, you're going to end up with 2 doses and 1 syringe. It has a max of 100 micrograms, and we can repeat Push Doss Epi in 5 minutes after our first dose to titrate to a MAP of 65. Okay, so the pediatric dose is going to be 1 microgram per kilogram, not to exceed the adult dose of 50 micrograms. We're going to titrate to blood pressure and MAP again, and there is a max of 100 micrograms for this dose as well. Something that's going to help you out in the field is utilizing this drug reference that's located in the back of your SOPs. What's nice about this is it has the pounds and kilograms on there, and it also lists the micrograms and the milliliters. So this is going to really help you when you're going to administer this to one of our little kiddos and figure out exactly what milliliter you need to draw up. Okay everybody, so we're going to get our Push Doss Epi all set up here. So first thing, we need our Epi preload, 1 milligram and 10 mLs, and our Push Doss Epi kit. So then we're going to want to go ahead and get our preload Epi all primed and set up. Next, you're going to want to open your kit and take out all the pieces. In your kit, you're going to have a 10 cc syringe, a 2-way fluid dispensing valve, and a 10 cc saline flush. Next, we're going to take our 2-way valve, open it up, a little green piece here, and it's got 2 caps on it. So you just want to make sure that you take off each of those caps before you try to hook anything onto it. These are all Luer lock connectors, so they should hook up to everything nicely. Take your Epi preload, hook it onto your 2-way valve, and then make sure you prime it. You want to have all the air out of that before you try to drop anything. Next, we grab our 10 cc syringe, open it up, and we want to make sure we label that right away. So we can hook it on there, but we don't want to drop any Epi into that syringe until it's labeled. It can be easily mistaken with the flush. After that's nice and labeled, we want to go ahead and draw up 1 ml of Epi into that 10 cc syringe, and then discard your Epi to the side. Next, we are going to grab our saline flush, open it up, and then hook it onto the other side of that 2-way connector, and we're going to draw up 9 mLs of saline into that 10 cc syringe, and so that gives us 1 ml of Epi and 9 mLs of saline, and that constitutes our Push Doss Epi for 10 micrograms per 1 ml. Please make sure you date and initial your Push Doss. All right, everybody, so after our Epi is all constituted, our next thing is to go ahead and administer. So our first dose is going to be, again, that 50 micrograms or 5 ml. So you're going to give half of your syringe IV push. If you are out on a call and can't remember how to drop your Push Doss Epi, please remember that the instructions are all written down for you in the back of your protocols under this Push Doss epinephrine mixing instructions page. You will see Push Doss Epi listed underneath your ROSC, or return of spontaneous circulation protocol, the adult cardiogenic shock protocol, the adult bradycardia protocol, the adult allergic reaction or anaphylactic shock protocol, the adult sepsis protocol, the pediatric sepsis protocol, the pediatric allergic reaction and anaphylaxis protocol, and the pediatric shock protocol. So please review these protocols and get familiar where Push Doss Epi has appeared in our new SOPs, and let us know if you have any questions, and stay safe out there.